Thank you, Mr. Speaker. I was going to rise to make a motion, but a young lady who's on staff in our caucus is getting married on Saturday, and I did not want to delay the vote for any longer than necessary, so I will not make that motion today. First, I want to thank my friend from Chester County, the chairman, Republican chairman of the Liquor Committee. We had a little bit of a debate in caucus yesterday, and he stood up after I was done speaking and said some kind words about me. So I want to thank him for those kind words, and I think that's a really good example that people in this General Assembly can disagree on issues, but still be very respectful to each other. Mr. Speaker, I served with a gentleman, many of the older members will know. His name was Bill Lloyd. Many of the people who have been here for a while know Bill. I think he was from Somerset County. And Bill Lloyd was very well known for taking every bill and reading every line and knowing what every word meant and knowing where the commas were and the periods were. And when Bill Lloyd stood up to talk, everybody would listen because everyone would know that he had something relevant to say about the issue. And on certain occasions, he would stand up, and I can picture him right there in the middle of the aisle, and he would say, "I guess this is just a bad idea, and I hope the time has not come for this issue." Mr. Speaker, I rise in opposition to House Bill 466. And there's a number of reasons that I am opposed to this bill, Mr. Speaker. And the first, and some of them are up in the galleries, are the employees who work for the state store system. I just want to let them know that there are many of us who really appreciate and value your good work and hard work on behalf of the state store system, Mr. Speaker. And I know it's been said in this bill 466 that there are certain things that are going to help these employees find employment if we pass this bill. I mean, I disagree with that. I mean, I look at the things that are in this bill and education credits and job credits and tax credits and points and preferences for jobs that aren't there, and I just don't see it, Mr. Speaker. These are, and again, the number is disputed, these are over 4,000 hard-working Pennsylvanians and Pennsylvania families who, if this bill gets passed, as far as I can see, are going to lose the way that they support their families and they support and provide health care for their families, Mr. Speaker. So that's the first reason, Mr. Speaker, that I'm opposed to this bill. The second reason is from the business aspect. And, Mr. Speaker, I look at this from a business perspective, and I come from a business background. Before I came here to a General Assembly, I ran a small business that had over 50 employees. And, Mr. Speaker, just doesn't make any good business sense as far as I can see. If you look at the revenue that the state store system has generated, the last one we have for 13-14, it was over $123 million in profit. Nothing to do with the taxes that they collected, which was over $400 million. $123 million in profit in 13-14. And as I look at the projected profits in 14-15, it looks to me that it's going to be over 130, possibly as much as $150 million in profit that the state store system generates. I mean, that is really substantial. So how do you take an asset, looking at it from a business perspective, you take an asset that you own, you put it up for sale. Now, I know the numbers that have been talked about what we're going to get from the sale of the licenses, somewhere around $1 billion. I mean, that remains to be seen. But even if it's $1 billion, how do you take an asset that makes $130 million or more in profit and sell it for a one-time fee of $1 billion or probably even less? I don't know how that makes good business sense, Mr. Speaker. And also, from our small business sense, I understand the beer distributors are going to get first crack at these licenses. Well, their association put out a letter opposed to this. Our small business people in every one of our district, I believe there's over 1,000 licensed beer distributors in the state of Pennsylvania, supporting well over 10,000 jobs. They're opposed to this, Mr. Speaker. And lastly, Mr. Speaker, and again, I say this all the time, alcohol is the most abused drug by far in this state and this country. And I'm going to say it again. Alcohol by far is the most abused drug in this state and this country. And I'm going to address this issue from a public health and a public safety part, Mr. Speaker. Yesterday, I went to the PCLB and asked them how many instances going back a few years of sales or violations of sales to underage drinkers. And you know what it is, Mr. Speaker? They went back over 5 years and could not find one instance of a state store in violation by selling to an underage drinker. Over 5 years, not one instance. Do you think that's still going to happen if we privatize? Does anybody think that's still going to happen? We're going from 600 state stores to 1,200, doubling, and then potentially going to 1,800 outlets that's going to sell liquor and wine. 1,800. And the previous speaker talked a little bit about Washington State. I mean, again, and he's right, look at the headlines and statistics from Washington State, who privatized 2 years ago. Their largest county, King County, in the year before they privatized, they had 10,000 instances of alcohol-related emergency room visits. A year before they privatized. The first year that they privatized, that went up to 15,500. 5,000 more emergency room visits in one county in the state of Washington. You all received a letter from the Fraternal Order of Police who was opposed. In their letter, they said, in the state of Washington, Washington City reports a 63% increase in liquor theft. I'm going to say that again, 63% increase in liquor theft and a 30% increase in alcohol-related crimes near the grocery stores and the liquor outlets. Look at the letters of the people who are opposing this, Mr. Speaker, from the public health standpoint, from the Drug and Alcohol Service Provider Organization, Mr. Speaker. They represent the majority of the licensed facilities in the state of Pennsylvania that provide treatment to our residents. Their concerns are public health and public safety. The research is overwhelming and underscores common everyday experience. Increase in access, such as that is reflected in the proposal being discussed, will increase consumption and with it increase alcohol-related problems. Mr. Speaker, Pennsylvania has the lowest rate of death from alcohol-induced causes in the nation. The lowest rate, and that comes from the Center for Disease Control report back in 2010. The Commonwealth Prevention Alliance, which represents all the prevention people in the state of Pennsylvania, opposed. Your drug and alcohol people in our county opposed to this proposal, House Bill 466. From the public safety standpoint, Mr. Speaker, you all have a letter from the Fraternal Order of Police. They represent 40,000 of the men and women who protect us each and every day in all of our communities. Mr. Speaker, listen to their words in their letter. Because of the likely impact on alcohol access and the instances of alcohol-related crime, and due to its potential to harm police officers' safety, we oppose House Bill 466. The Fraternal Order of Police, all of our police officers, from the Professional Firefighters Association, representing 10,000 firefighters across the state of Pennsylvania. And by the way, Mr. Speaker, when I go back home and talk to my volunteer firefighters, I hear the same thing about the idea of privatization. Listen to what's in their letter that you all received. Every day, our members take to the streets to protect the residents of our state. Any scheme that would potentially place these brave men and women to increased danger through privatization is unconscionable. Unconscionable, Mr. Speaker. Yesterday, we received a letter from the Police Chiefs Association representing 1,100 of the men and women who are police chiefs in our state, almost every one of our municipalities and boroughs. The letter opposes House Bill 66. Mr. Speaker, I know this bill, almost the identical bill, went over to the Senate back in, I believe, March of 2013. They had almost 21 months to consider that bill, and it never moved at all, Mr. Speaker. The governor, Governor Wolf, had said that he will veto anything that deals with privatization, Mr. Speaker. Mr. Speaker, you can't dispute the facts when it comes to public health and public safety, Mr. Speaker. Look at the groups that are in favor of this, Mr. Speaker. The groups that are in favor of this are only the groups, basically, who have a stake economically in this, in opening up stores. Also, our newspapers have all been in favor of this, Mr. Speaker. They want to get the advertisement from this, Mr. Speaker. Mr. Speaker, I would just ask everyone to really think long and hard about what we're doing here today, Mr. Speaker. This is going to cause so many problems when it comes to public health and public safety. This is just a bad idea, Mr. Speaker, and I ask the members to vote no on House Bill 466. Thank you.